Welcome to the Weekend Cancer Communication Toolkit Kickoff webinar. My name is Ambrisha Johnson, and I'm the lead specialist on this project. So let's start off with some information about the National Rural Health Resource Center. So the National Rural Health Resource Center is the nation's leading technical assistance and knowledge-centered focused on rural health, directly supporting rural hospitals, clinics, and community health centers, state offices of rural health, and other rural health organizations with information, tools, and resources designed to help sustain access to quality health services in rural communities and improve the health of residents living there. So the Delta Region Authority and the Health Resources Services Administration's Federal Office of Rural Health Policy have partnered to support the Delta Region Community Health System Development Program. Through a cooperative agreement with FORT, the center administers the program and manages the provision of services to selected hospitals and communities. Services are provided through technical assistance, which includes various assessments, on-site consultations, action planning, and coaching implementation of best practices and adoption of key transition strategies. So our goal for this project is the weekend project is to be whole person focused, empowering community collaboration, connecting resources to patient needs, advancing cancer awareness and prevention, and narrowing cancer barriers and disparities. So through our proven community care coordination process, the weekend project will increase cancer awareness and prevention in rural communities, address provider training, service line development, education, improved outcomes, and assess social drivers of health needs and barriers identified by our rural communities. So through the Weekend Cancer Project, we are excited to introduce the Cancer Communication Toolkit. This toolkit contains messaging focused on cancer prevention and awareness for breast, colorectal, lung, and prostate cancer. We are so excited to officially announce the new messaging and material in forms of newspaper ads, posters, flyers, social media, radio, and so much more. Like to introduce our consultants from McDaniels Marketing, who have played an integral role in developing our customizable cancer communication toolkit. We are joined by Jacob Brisbane, our client growth strategist, Jeff Erickson, creative strategist, Avery Rainwater, which is the graphic designer on this project. We partner closely with McDaniels Marketing to create and design this resource, and I'll now turn it over to them to share more about this toolkit.
Okay, let me get my screen up here. Going to do that. Okay, are you able to see that?
Yes.
We're good? Okay, awesome. So, Jacob, do you want to kick us off here?
Absolutely. Thanks so much, Jeff. And thank you so much, Ambrisha, for having us today. We're very excited to get to share the Cancer Screenings Communications Toolkit webinar with you today. We greatly enjoyed partnering with the National Rural Health Resource Center on this project. Myself, Jeff Erickson, creative strategist, he had a great deal to do with all of the awesome creative elements in this. We really do feel it will be very impactful and will help to save lives in rural communities. And we're also joined today by Avery Rainwater. She was the brilliant graphic designer behind all the beautiful graphics that you'll see today. And I'll go ahead and pass off here to Avery before we get started with Jeff today.
Hi there. I am Avery. Jeff, do you want me to explain now the concepts, or did you?
No, I guess just a little bit about yourself, and then we'll get into it, and then we'll just get into the rest of the slides. Yeah.
Okay. Yeah, I've been with McDaniels for about 3 years now. I just recently moved to Charlotte, and they kept me on remotely. We worked together to create this awesome toolkit for you guys, and I'm really excited to show everyone our project.
Cool. Yeah. So as you guys know, I'm Jeff, creative strategist and writer at McDaniels Marketing. Although I've only been with the agency less than a year, I've worked on healthcare campaigns all over the country for like over 25 years. Places like Our Lady of the Lake down in Baton Rouge, Southeast Missouri Hospital in Cape Girardeau. I also worked on 2 Affordable Care Act projects in New Mexico and Hawaii. And then currently at McDaniels, I work on Spooner Health, which is a 25-bed facility up in northern rural Wisconsin, as well as Sparta, which is down in downstate Illinois. So lots of healthcare experience, done it a long time. And this was a really cool project because it really focused on something that was very actionable for people, and it's get the screening, because that's the most important thing, because without the screening, when people don't get screened, the end results aren't as good. So we really, really want people to get in early, get screened, and then again, the treatment can start if necessary, or if not, even better, they're screened, they're good to go. So that's really what this whole campaign is about. Hold on here. So a little bit, just kind of overview on McDaniels. We've been around since 1966, and we've been in the rural healthcare marketing space since 1989. And these are just a few of the clients that over the years, and we still have across the country, varying degrees of sizes, different issues you can see of things that we cover, pretty much the full gamut of clinics and healthcare, and different aspects of things, whether it's surgery or emergency departments, all of that stuff are in our wheelhouse. So just kind of explaining us a little bit, we're one of the Midwest's most experienced marketing, design, and web development agencies. We've worked with hospitals, health system, and physician groups in a mix of all mediums. So whether it's traditional, like your billboards and your prints, to digital, geofencing, everything like that, we build websites. So our integrated campaigns not only cause people to stand up and take notice, but they also deliver powerful results. And we like to measure things too, to make sure that what we're doing is connecting, and then we can grow from there. So some of the bullets on the point: we help craft image and brand strategy. We look for opportunities to innovate and build preferences for services. We also test our strategies, like I mentioned, on the target audiences that we need to have take action. We balance campaigns between traditional and digital all the time, and then we move the needle, and we want people to talk about the brands. And we think that this campaign is very talk worthy, and will generate talk amongst our audiences in order to get that action, to get them to get in and have their screenings. As you kind of notice, Avery mentioned she's in Charlotte. I'm in a Milwaukee office. We have an office in Rockford, but we are headquartered in Pekin, Illinois, which is right near Peoria, kind of in the middle of the state of Illinois. So that is about us. Before I continue a little bit, I just wanted to kind of explain how we're going to see things today. So we'll go over the work, and then we'll kind of go into a dive of the copy. We'll read through. We won't read through everything because at some point it'll kind of get repetitive, but we want to make sure that you understand what the campaigns are about. Avery at the very end will kind of walk you through how to customize your work and put your logos into the work. So we'll do a little tutorial at the end, and then at the very, very end, we're going to leave some time for some questions and answers, to let you guys, if you have any concerns or questions or want us to dive deeper into something, we'll leave time for that at the very end. One more thing before we go, just kind of wanted to share how this campaign came about. So we start by creating a really sound brief, and that's kind of like our blueprint for what we want the campaign to accomplish. From there, the creatives, creative teams, and account side, and everybody kind of works together. We came up with a lot of different ideas. And again, we always think you want to have quantity to get to quality. From there, we fleshed out 4 different directions. And at that point, we shared stuff with Ambrosia and her team, plus advisors from a couple other hospitals, just to see, get the tone of, are we going to be on track with this campaign? From there, we picked one campaign, and that is what you will see today. Oops, sorry, there we go. Oh, sorry. Yeah, so just real quick, just want to explain this. So again, Ambrosia already covered this, but basically this is the campaign. We have breast cancer, we're talking colorectal, we're talking lung, and then again, you'll see these in these 7 different mediums. So that's newspaper ads, posters, flyers, social media, radio, landing pages, and the brochure. And this is the campaign direction. So this is just kind of an overview to give you a feel for how the work will show, which you'll actually see in a little bit. But basically, we're calling this meaning to screening. So the idea here is, yes, living is a good reason to get checked for cancer, but the importance for living for others can be an even bigger driver for those afraid to get a screening. This direction makes others around us the reward for staying healthy. And what was interesting as we were coming up with this campaign, a number of us on the team had some there's some truth in this. So we had, I think, the owner of the agency, Randy, had a family member who was hesitant to get screened. My own father was really kind of not wanting to do that, and he passed away. So there's some realness to this, and it's not meant to be a scare tactic, but it's just sort of like, you know what, maybe I should get screened. And Avery, I don't know if you want to talk a little bit about the visual kind of directions we're taking here.
Yeah, like Jeff said, there was a lot of personable experiences that played into this idea when we were talking about it. We really wanted to be direct, emotional, kind of no questions about what it was when you see the creative. It's kind of pretty self-explanatory. Your loved one is looking right back at you, asking you to get screened. We have different ages, different ethnicities, and we really wanted to appeal to everyone who is going to be viewing this campaign. Yeah, so that's about it.
Cool. So this is the overview, and I'll blow in bigger so we can read through this. But basically, there's lots of different sizes you can choose from. So again, depending on your market, what you're interested in. The other thing too is maybe newspaper isn't right for you. Maybe just flyers are the way to go. So we wanted to give you lots of tools in the toolkit to actually use these effectively for what's going to work best in your market. So looking at this, you'll kind of see how this campaign comes together, but it's sort of like that sort of wanting to do this for the right person. So here's someone's daughter, and it says, in 14 years, she'll graduate with a degree in architecture. Will you see her throw her cap in the air? Then the copy goes on to say, regular breast cancer screenings are important for you and the ones you love. If you're considering whether to get a breast cancer screening, consider who else your decision might affect. Breast cancer is the second leading cause of cancer deaths in women in the US behind lung cancer. Start regular self-exams and mammograms at the age of 40 or sooner if you have a family history. Early detection can lead to longer, happier lives for everyone. And then you'll notice on the right, we give space for customization, whether that's, what URL you'd like to use. Is there a custom phone number? And we also recommend talk to your provider. And you'll see there's a placeholder for your own logo in these ads. So I'll move on to the second one, again, showing all the sizes. But the important thing is you'll see how the story kind of carries through and is similar, but a little different for each type of cancer. So this says, he is your first grandchild. Make sure you can spoil him against his parents' wishes for years to come. It says then, regular colorectal cancer screenings are important for you and the ones you love. If you're considering whether to get a colorectal cancer screening, consider who else your decision might affect. Colorectal cancer is the third most common cancer worldwide. It's recommended that men and women with an average risk start getting screened at age 45, and those with close relative diagnosed before age 50, screening around age 35. Early detection can lead to longer, happier lives for you and for everyone. Oops, sorry, hit the wrong button here. We don't want that. Okay, so again, here's lung cancer. Again, as Avery mentioned, we're mixing up different ages, ethnicities to kind of cover the range of people. This one reads, he shares your strong work ethic. Will you be around to see if his kids do too? Regular lung cancer screenings are important for you and the ones you love. If you're considering whether to get a lung cancer screening, consider who else your decision might affect. Lung cancer has the highest death rate in the US compared to any other cancer. If you smoke, were a smoker, or have been exposed to radon gas, asbestos, arsenic, chromium, or nickel, ask your provider about a yearly low-dose CT scan. Early detection can lead to longer, happier lives for everyone. And again, you'll notice there's plenty of room for customization on the right. And then this is the fourth in our campaign. You'll see these faces throughout the campaign. So this one now reads, you promised she'd see the Eiffel Tower. Don't make her experience it on a group tour with strangers. Regular prostate cancer screenings are important for you and your time with her. If you're considering whether to get a prostate cancer screening, consider who else your decision might affect. Prostate cancer is the second leading cause of cancer deaths in men in the US, behind lung cancer. It's recommended that men ask healthcare providers about being screened for prostate cancer starting at age 50. Early detection can lead to longer, happier lives for everyone. So I'll move on. So again, different mediums speak in different ways. So posters, obviously you don't want to have as much copy in them because again, it'll be seen in a lobby, in a waiting room, across the hall, but we still want to get those important messages out there. So you'll see the theme continue with the big bold headline, that face staring at you. Again, in 14 years, she'll graduate with a degree in architecture. Will you see her throw her cap in the air? And then this copy gets a little simpler, and it says breast cancer is the second leading cancer of deaths of women in the US, behind lung cancer. Start regular self-exams and mammograms at the age of 40 or sooner if you have a family history. And then we have the customization built in there as well. So again, this will look branded by your organization and not ABC Hospital. So here's another poster. Again, that theme carries through. He is your first grandchild. Make sure you can spoil him against his parents' wishes for years to come. Colorectal cancer is the third common cancer worldwide. It's recommended that men and women with an average risk start getting screened at age 45, and those with close relative diagnosed before age 50 start screening around 35. And then again, that customization is built in there for you to look at. It's up a little bit, sorry. Okay. Again, this is for lung cancer. He shares your strong work ethic. Will you be around to see his kids do too? Lung cancer has the second highest rate of death in the US compared to any other cancer. If you smoke, were a smoker, or have been exposed to radon gas, asbestos, arsenic, chromium, or nickel, ask your provider about a yearly low-dose CT scan. And then again, that's customized. And then for prostate cancer, again, that sort of be there for that person you love with that message about don't make her do this on a stranger, go experience and live your life together with the one you love. And the copy reads, prostate cancer is the second leading cause of cancer deaths in the US, behind cancer. It's recommended that you ask your healthcare providers about being screened for prostate cancer starting at the age of 50. And then again, the customization is there built in for you. So I won't go into all of the copy on these because again, you guys can look at this stuff later as you know, when we're done. But so what we have here is this is a flyer. So imagine now this is something that you can put in the rack in a waiting room, have at your front desks and things like that. But you see the strong branding messaging here. So again, the faces and those interesting messages about why this is really important. And it's for not only for yourself, but the ones you love. So what's interesting here is now we can get a little more detailed with the copy and things we can do. So the first message is a lot of what you saw in the print and the posters, that kind of the overview. It's important for you and the ones you love. But now we can get into a little more detail because this medium is like handheld right in front of you. So we can now start talking about who should be screened and when. And then we can also get into a little bit of details about the screenings, to what's going to be involved, how long it takes, those sorts of things, and the importance of them. And then little details, whether it's the 2D mammograms or 3D mammograms, just giving people a little more information. This is just a nice way to tie this all together. So if I saw a poster, I might grab a flyer that gives me more information. Now I can go walk over and talk to a nurse or my provider to say, hey, what about this? What's the best type of screening for me at my age? Do I have a family history? Now we can start that conversation to cause the action that we want. Again, you'll see the same kind of branding throughout with the nice face and the reason why. The opening copy on your upper left mirrors what's been seen in the print and the posters. Now we can get into the other parts of who should be screened and when, and then we can get into some details about the actual screenings to let people know what they need to do. And then this is for lung cancer. Again, you'll see the cadence of the strong branding message with the face and the reason why. Then we can talk about who should be screened and when, and then we can get into what the actual screenings will be. And then this is the fourth cancer for prostate. Again, same kind of cadence. Here's why you're doing it. Here's who should be screened and when, and then here's what the actual screenings are like. So these are our digital components. So whether these get used for, they're just kind of the little tiles that can be used for digital display campaigns or social, if you want to use them for that as well. We have these in 2 sizes for you to choose from. So again, this is going to be on your phone, not a lot of reading. You want to capture people quickly. So you'll notice that we made the images bigger. The headline's a little bigger, but then a very short call to action about regular cancer, breast cancer screenings are important for you and the ones you love. Regular colorectal cancer screenings are important for you and the ones you love. So very, very short messaging, but still pretty engaging to see those faces, read that headline to really kind of pull you in to want more information. And then this is just a different size for you to choose from for your digital. So I'll jump into radio. I'm not seeing if anybody has any questions, so I'll keep going. So radio, these can be produced on your own. We can help produce them however you want to do it, depending if you wanted to record that in-house or give this off to a radio station. The script is ready to go. So you'll feel, again, put some nice music behind it, but it's very similar to what you've seen. Now we're using theater of the mind to carry that story across. So this reads, in 14 years, your daughter will graduate with a degree in architecture. Will you be there to see her throw her cap in the air? If you're considering whether to get a breast cancer screening, consider who else your decision might affect. Breast cancer is the second leading cause of cancer deaths in women in the US behind lung cancer. Start regular self-exams and mammograms at the age of 40 or sooner if you have a family history. Learn more at, and then you could customize there. And then it says, because early detection can lead to longer, happier lives for everyone. So really, again, that continuity of the whole campaign, whether it's visual or audio, we wanted to make sure that that comes through very clear. So this is for colorectal. You just welcomed your first grandchild. Make sure you can spoil him against his parents' wishes for years to come. If you're considering whether or not to get a colorectal cancer screening, consider who else your decision might affect. Colorectal cancer is the 3rd most common cancer worldwide. It's recommended that men and women with an average risk start getting screened at age 45, and those with a close relative diagnosed before age 50 start screening at around age 35. Learn more at your hospital, because early detection can lead to longer, happier lives for everyone. And then lung cancer. Your son shares your strong work ethic. Will you be around to see if his kids do too? If you're considering whether to get a lung cancer screening, consider who else your decision might affect. Lung cancer has the highest death rate in the US compared to any other cancer. If you smoke, were a smoker, or have been exposed to radon gas, asbestos, arsenic, chromium, or nickel, ask your healthcare provider about a yearly low-dose CT scan. Learn more at your hospital, because early detection can lead to longer, happier lives for everyone. And then for prostate cancer, again, the theme comes through. You promised your wife she'd see the Eiffel Tower. Don't make her experience it on a group tour with strangers. If you're considering whether to get a prostate cancer screening, consider who else your decision might affect. Prostate cancer is the 2nd leading cause of cancer deaths in American men behind lung cancer. It's recommended that men ask their healthcare provider about being screened for prostate cancer starting at age 50. Learn more at your hospital, because early detection can lead to longer, happier lives for everyone. So those are the radio scripts that you can use. They can be customized with, again, whatever kind of call to action, whether it's the name of your hospital, whether you have a special phone number you want to use, or if there's a URL, that can be customized however you wish. I won't read through all this, but so we also gave you landing page copy. So again, this is sort of like the more expanded flyer. What we could do here, again, because now we're like, if you think about the marketing funnel, you got to get people's attention up here. And then as you get them further down the pipe, you can start giving them more information. And then at the end, hopefully now, by this point, hopefully they're ready to talk to their doctor. But so what this allows us to do is we can say things, you know, again, if we use the imagery or not from the campaign, it would go in here, but we have like, don't live with fear, live long. And we want to talk about generally early detection saves lives. Here's what you need to know about breast cancer. So we can be very informative in this medium. So we, again, overview about how dangerous it is. Then we can talk about who should be screened and when. The other thing that we can do, which is nice here, is now we can start talking about some signs. We have room to talk about that stuff. So we can talk about breast cancer symptoms and signs of breast cancer, because this gives us the time and place to talk about this in more depth. Then we can also talk about how the different screenings are available to people. So you see the same kind of cadence with colorectal cancer. Don't live with fear, live long. Early detection saves lives. Here's what you need to know. We get into what you need to know. We can then talk about who needs to be screened and when. The other thing now we can do here is when you get to this part, we can now talk about some symptoms. So now we can get a little deeper and have people we don't want people self-diagnosing, but this gives people a little bit of things to watch out for. If they're feeling different, maybe it's time to talk to their doctor. And then as well as we can talk about the different types of screenings available. Same cadence with lung cancer. Again, what it is, how dangerous it is, who should be screened, some symptoms if you're feeling these things, and then we can talk about the screenings. And then again, with prostate cancer, don't live with fear, live long. Early detection saves lives. Here's what you need to know about prostate cancer. Talk about the details, talk about who, and then again, now we can talk about some symptoms, some things you might be feeling that you want to talk to your doctor about. And then again, we can go into the process of what the different screenings are and what they entail. So this was the other piece of the sort of marketing puzzle that we're providing. So this is a brochure. So what you're looking at is if it was unfolded. So we put some just information at the bottom. So basically the third panel, it says front. So that's what people will see on the cover. And it's a gatefold, so it goes in like this. So this says, don't live with fear, live long, early detection save lives. And then again, what we did here is we wanted to give a tool that had all 4 cancers put together in one. So throughout the whole campaign, there's these different messages. One of them may be more prevalent in your market than another, but the brochure covers all 4. So at the bottom, we put your guide for breast, colorectal, colon rectal, lung, and prostate cancer screenings. So when you open it up, your inside left, you have the images from the campaign. So there's the continuity there. And then we talk about on the inside right, again, talking about how important it is. Regular cancer screenings are important for you and the ones you love. So this kind of explains the guide a little more. If you're considering whether or not to get a cancer screening, consider who else your decision might affect. Please use this guide to see which cancers you should be on the lookout for and when you should get screened. Early detection can lead to longer, happier lives for everyone. And then on the back, what we wanted to do is this is where you could provide some customization. You could go into a little more, have some copy detail about your organization or the types of screenings you can do. So this whole back is customizable. The other thing that we wanted to give is if you wanted to have it gives you room if you wanted to put in a testimonial or announce a special program, whether you got a new scanner or you're doing some new kind of testing. This gives you the room to kind of customize it for something that's really specialized to your organization. So we wanted to give you that space there. And then this is the inside. So if you imagine you unfold it all the way. So we talk about the 4 cancers. They each get their own panel. A lot of this copy is from, I believe, like the flyer. So again, it doesn't get into the details of necessarily what to look for, but basically what it is, why it's so important, who should be screened and when, and then the different screenings. And the other kind of nice thing too that we played with here is we kind of expand, like if you'll notice, like, let me go back. So like, here are the people that you want to do this for and live long for. And there's just a nice little sort of like, here's these people together with you. So because you got screened, all of these wonderful things in life can be enjoyed. So we kind of wanted to have that kind of just nice visual sort of resolve to, if you go, you know, sometimes getting screened can be a little scary, but the result is being able to have all this time with your loved ones. We'll have questions if we have questions now, or do you want, Ambrisha, should we just go to Avery's part, or what do you think?
Move on to Avery, and then we'll
Okay.
say for the end.
Okay, are we doing on time? Okay, we're good. I talk fast, sorry. Okay. Oh, do I need to stop sharing my screen, Avery, or?
Let me see. I can replace the current share.
Okay.
Oh, hang on, sorry. I have to allow. This, give me just a second. This might kick me out of this meeting.
Okay.
I'll be right back.
I'll just read through this. So when you get this guy, go ahead, Avery. I'll just kind of walk him through. I'll just read through this. So basically, at the end of the toolkit, we put in some instructions for you. So it just explains your software requirements for the template customization. You will need to have Adobe Acrobat Pro. And again, she'll be able to walk you through how to do that in a little bit. But basically, those are the instructions are here, and there's more instructions on the next page about how to really go through it. And again, if you need help, Ambrosia is there to kind of help you customize things. But you will need Acrobat Pro as well as Microsoft Word for the radio spots and the social media posts and things like that. Able to come back in. And then while we're waiting for her, I'll just show you the next, this is what she'll walk you through. So these instructions are provided for you at the end of the toolkit, to kind of, again, the step-by-step what it takes to go ahead and whether it's replace the text in some of the materials or the actual logo itself, which would be I think from PDF files and things like that. So
Hey, Jeff,
yeah.
can you guys see this screen?
No.
Yes, I think.
I'm moving.
Stop sharing?
Yes.
Should I stop?
I think I took over your sharing.
What are you wanting us to see? Is it a woman?
It's yes, the woman.
Yeah.
Yeah, we can see it.
Okay. Okay, so for customization, this is what it will look like when you open your PDF. There's a couple ways to do it. You can either go over here to edit a PDF, or you can go to edit. It'll take you to the same window. So once you hit edit PDF, these will pop up in boxes, and you can click on the logo.
Avery, hold on 1 second, because some people are saying they can't see. Jeff, could you stop sharing your screen?
Because
Just let
actually I couldn't. So okay, there I stopped.
Okay, what about now? Perfect. You can continue. Thank you, Avery.
Okay. Okay, so for those of you who missed that, you can either go here to edit, or you can go to edit a PDF. It will take you to the same place. From there, you can click on each individual thing. Sometimes there's a window that pops up, but if, like in this case right now, it's not popping up, you're gonna hit right click, replace image, and then choose image. And then you can go from there and find your logo that will fit the space. So if McDaniels was customizing this, I will choose this logo. And this is a little bit big for a logo, so if you want to scale it down, you can. If you need to move it, as you notice, it will jump back into place. So if you want to, you're just gonna right click and go to make in front of text, and then that will allow you to move it where it's not gonna jump back in place. So once you have that, you can go up here to your customizations and put in your phone number. Oops. And your web. And then if you have a /, it might run off, but you can just push it down to the next line. And then you're going to go to File and Save As. Find your folder and then name it how you want and save. I will show you the brochure, which is just the same steps, but if you want to customize this section, you'll also highlight this and customize that. Again, there's that window that I was saying that might pop up. Choose image. This one, we'd want to use a white logo. So that will be replaced there. If you are wanting to add customization on the back, you can just go to the Edit tab, the text, and then you should be able to click and drag a box and add your customization there. There is color right here, line size, font size, and we did use Helvetica for all the text if you want to match that to that. The last thing I wanted to show you was the social. Let's see here. Gonna go replace your logo. Oops. So this one pops in a little bit big, so you'll want to size it down. Right click, make in front of text, and then that way you'll be able to line it up with the little line and the copy. Note for the social ones that you're going to want, you'll import these as PDFs so that you can edit it. However, you're going to want to save as a JPEG so that you can post it. Otherwise, the socials and Google won't accept it as a PDF. Name it different and then choose JPEG. Okay. Sorry, I went through that kind of sporadically. Was there any questions that you guys had about how to customize?
Not seeing anything.
Okay.
I had a question. Hello.
Hi, Leah. Go ahead.
Hey, Ambrosia. My hospital doesn't have Adobe Pro, and can't afford it. So is this customizable in any other program other than Adobe Pro?
Yeah, since you all do not have access to Adobe, you can send it to me and we can do the customization in-house for you all. So just let us know like details of what you want changed along with like your logo, and we can handle that in-house.
Okay. Thank you.
No problem. Do we have any other questions before we continue? Okay, Jeff, you can continue.
Okay. To this. So can you see my screen again?
Yes.
Okay, good. Okay, so yeah, we walked through that and that. And really, the other thing that, and actually I think Jacob, you're gonna talk about this a little bit with everybody.
Absolutely. So we were able to also provide Spanish translations for the brochure, the flyers, the newspaper ads, the posters, and the social media content. All this was professionally translated. We have a long-standing relationship with a professional contractor that does this. So this is all done by expert translators. We also are blessed to have bilingual individuals in-house as well here at the firm. So we always double, triple check our work. So we are more than happy to direct you to, of course, when you do have the link to all of the deliverables, you'll find these actually in a separate file folder that is entitled Spanish translation. So if you do happen to be in an area where there are a good number of Spanish speakers, you will have the materials to provide those individuals as well.
Yeah. So that kind of gets us to our end. And again, like Jacob mentioned, all of this stuff is available in Spanish if you do need it. And again, I think the thing here is it's customizable for whatever is good for your market. So you might not, maybe posters are good, or maybe just posters in Spanish are good, and then you're okay with doing the brochure in English. So that it's all kind of mix and match for whatever sort of the media market is like in your area that you want to choose from. And again, you can mix and match. It doesn't have to, you could go all in with everything, or just one of the pieces, or just a couple here and there for whatever you feel is right. The other thing about that customization is, again, in certain areas, maybe there's already an ongoing, you have a breast cancer initiative, but really lung cancer is kind of important and you don't have materials for that. So you don't, again, you could pick the whatever is kind of really, really important for your market. And again, if you have existing materials in some of the other 4 cancers that we talked about, then you wouldn't have to use those. So I guess throw it out to anyone if there's any questions, whether it's formatting, the templates, the mediums, the message.
Looking through the chat, I'm not seeing anything. Making sure nobody's hand is raised. Okay, I want to thank our consultants once again for the amazing job you all have done on this project. I do want to let you all know that we are hoping to have this information published on our website by Friday. So it will send an official announcement out once everything is posted. But I do want to thank you all for your time today. And if you all have any questions about anything, please let me know. And I hope you all have a nice rest of your day. Thanks, everyone.
Thank you.
Thanks, guys.
Bye. Thank you. Appreciate it.